So now we'll see what are adverse drug reactions. So here, after taking the drug into our body, it may undergo various sort of reactions. In the sense, the drug may interact with the other drug, or the drug may interact with the food, or while manufacturing the drug, while we are preparing the drug, there will be the main ingredient drug along with a few excipients. Excipients are like flavoring agents in order to add flavor, in order to add good odor to that. So in order to add, or else in order to make the tablet smooth, so we are adding various excipients. So this drug may interact with the excipient. So there are various kind of drug interactions. So because of all these interactions, there will be severe consequences. In the sense, there may be severe side effects which are called as adverse drug reactions. So here, the drug which we are taking, it will have beneficial effects, as well as at the same time it will have side effects also. So for example, if we are taking for fever, we are taking a tablet called paracetamol. So paracetamol will reduce the fever, but at the same time it is having its own side effects. So it is how much beneficial, at the same time it is that much toxic also. And the drug will improve our life, or else the drug will improve our life as well as improve our health, but at the same time it is also life threatening. So if we use any drug for longer period of time, it may have severe toxic effects in the body. So see, what is an adverse drug reaction? So adverse drug reaction, in the sense, it is a reaction, or else it is an undesirable effect which is caused because of the overdose of any drug beyond its therapeutic effect. So for example, if we take a drug is showing a drug is showing its therapeutic effect or useful effect at 50 mg dose, but if the dose exceeds beyond this therapeutic limit, then it leads to severe undesirable effects which are called as adverse drug reactions. And this adverse drug reaction, it may be because of the overdose of any drug, or it may be the lack of efficacy of any drug. If we are giving any drug beyond its dose, or if the dose is given in excess. For example, if we use paracetamol for a longer period of time or chronic period of time on regular basis, it will cause toxicity to the liver, because paracetamol side effect is hepatotoxicity. So here, on overdose, it may lead to toxic effects. For example, if we take the toxic effects, if we take accidentally any drug, or if we attempt any suicide, or if a person is attempting any suicide, or if we take any drug accidentally, then it leads to toxic effects. The other one is if the drug is not having, or if the drug is not that efficient to show its effect, so then that leads to the adverse drug reactions. If we see what happens, or what are the events, like what happens because of these adverse drug reactions. So here we can see injury resulting from the medical use of any drug. So if we are using any drug, there may be some sort of damage or injury causing in our body. The other one is includes medication error and adverse drug reactions. So here, after the adverse drug reactions are occurring, or it may include medication error. For example, if we take the doctor prescribed, so most of the people don't understand, or the pharmacist who is giving the tablet itself don't understand sometimes the writing of the doctor, and then he may misguide or mislead to give another drug instead of the drug which is to be given. So these are some of the prescription errors which leads to the adverse drug reactions. Instead of one tablet, if it's giving another tablet, then it leads to severe consequences. The other one is medication error. So that is what I said, medication error, in the sense, instead of one drug we are taking another drug. Or sometimes what we do is, like, the doctor says don't take this tablet at this time, or that he says that don't take this before meal, take it after meal only. But we forget, and we miss one dose and we take it to the other dose. So these are all small things, or these are all small considerations we have to take into consider while taking any medication. Because why a doctor says to take this, because it is having some sort of reactions with the other substances which we take. So that is the reason each and every drug has to be followed according to the prescribed practitioner. The other one is adverse drug reactions. So if we take any toxic, if the drug is taken on overdose, or if it is not taken on proper frequency, then it leads to the adverse drug reactions. So why these adverse drug reactions are serious problems? Why they are very serious? So one thing is that they causes adverse consequences to the patients. For example, few drugs are having adverse drug reactions. So if any drug reacts with the other drug, it may lead to severe rashes on the body, or it may lead to severe cardiac events. So it may lead to sometimes death of the person also. So that is the reason these are very harmful. The other one is it may cause some inconvenience or uncomfort to the person, and thereby sometimes it may lead to coma and death. The other one is high incidence. It has a very high incidence in the clinical practice. So these adverse drug reactions are very common because of the negligence, or because of the improper medication. Then that leads to adverse drug reaction. What are the consequences of adverse drug reaction? So what can be the results of these adverse drug reactions? So it may lead to, or else we are putting the patient's life into risk. So quality of the patient, quality of the life of a patient can be disturbed. The other one is complicated drug therapy. So for example, if we take diabetes, so there are many medications used. So multiple medications, or polypharmacotherapy. So in this, what we are doing is that it's very complicated for the person to take multi medications. So we may take one drug with the another drug, or if a drug which has to be taken in the afternoon can be taken morning by the patient. So all these complicated drug therapy may lead to adverse drug reactions. And drug compliance and delay cure. So the drug should be compliant, or the drug should be accepted by the patient. So if the patient is not accepting or willing to take the drug, then he won't take the drug, and that may lead to adverse drug reaction. That may lead to severe toxic effects. And the other one is delay cure. So the drug prescribed, because of the tolerance or dependence of the drug, that may not cure, or it may show delayed cure, or because of the long lasting effect, long lasting half life in the drug, that may have delayed effects. So because of that also, because of the adverse drug reactions, these may all result. And increase the cost of patient care. So even the patient who comes have to be affordable in order to take medication. Then it cause patients to lose confidence in their doctors. So here the patient should have belief. So in order to take any medication, the patient should have belief. So they have to have faith on the doctor. Like if we are taking this medication, then definitely it has to cure for us. Doctor prescribes, and if the person is taking seriously and even it's showing delayed effect, so it's neither the problem of the doctor nor the problem of the patient, but it's problem with the medication or the adverse drug reactions which are taking place by this drug. So the patient should have confidence or faith in the doctor in order to take proper medication. The other one is the drugs may mimic the disease. So here there are few drugs which mimic the other disease. They may show the symptoms of the other disease as a side effect. So all these lead to adverse drug reactions. Now let us see the classification of adverse drug reactions. How these adverse drug reactions are classified. So these are classified based on three features. One is onset of action, the other one is severity, and the other one is the type which it belongs to. So based on the onset of action, these adverse drug reactions are divided into three types. One is acute, one is subacute, and the other one is latent or chronic. So acute in the sense for short duration of time, that is for within 60 minutes, within 1 hour, whatever the drug reactions, or within 1 hour if a drug is acting, so what are the side effects of this drug. So these are acute type of reactions. The other one is subacute, which are lasting for about 1 to 24 hours. The other one is latent or chronic, which are staying for about more than 2 days. Based on severity of the event. So based on the severity. So here we can say they are divided into mild, moderate, severe and dangerous. So here mild in the sense very few effects, very few toxic effects are there. If you see, they do not, these are like, for example, if you take any drug, it may lead to small rashes. So this is some sort of mild adverse drug reaction. So these are like, if we there is no need for any serious therapy, or there is no need for any antidote for such type of reactions. They'll cure themselves, they get vanished or diminished themselves. And these are like, we can say, common side effects like headache, dizziness. We get them as a side effect of one drug, but after few moment or after some time that may be diminished. The other one is moderate. So moderate are like some sort of adverse drug reactions which need to be taken some special treatment. So if there are any for example allergic type of reactions, so these are to be taken care if they are occurring as a side effect of any other disease. That person has to consult a doctor immediately. And then severity. So these are like very serious effects. So these sometimes may be life threatening also. In that cases, we have to immediately take the person to the hospital, and it requires discontinuing of the drug. So if we are taking any drug and that the drug is causing a life threatening side effect, then that drug has to be discontinued immediately. We should not continue that drug anymore. And the other drug is specific treatment of adverse drug reactions. So in the sense, for example, in the moderate type, we are consulting a doctor and the doctor is prescribing against this adverse drug reactions. So the doctor is giving any medication because for this adverse drug reactions, that these drugs and the main drugs which we are using, that may interact and that may leads to severe adverse drug reactions. And the other one is lethal. Lethal in the sense the person, there occurs the death of the person itself. So these are very dangerous, either directly or indirectly they are affecting the death of the person. So all these come under based on the severity. So what are the serious consequences of adverse drug reactions? So what are the serious results which are occurring? First thing is that may lead to death of the person, and the other one is it may be life threatening. The person will almost die, or he may go into coma, and it requires hospitalization. The person to be immediately hospitalized. And the other one is once after he is hospitalized, the hospitalization may be prolonged, or the person has to visit the doctor very frequently in order to face or in order to reduce these adverse drug reactions. And sometimes it may cause disability. The person may become disabled also, and it may cause a congenital anomaly. So this is some sort of adverse drug reactions or adverse drug seriousness which is causing to the body. The other one is it requires intervention to prevent permanent injury. So we have to find some alternative source in order to prevent the injury. So few drugs, they causes hemolysis in the body. They break down the RBC. This is like we can't do anything. If there is any external injury, we can put some cream or medication or ointment and that can be cured. But here the internal injury, what is going on in the body, then that has to be taken or that has to be given a permanent treatment. Otherwise, that may lead to the lethal condition of the person. Let us see the adverse drug reaction based on the type. So here, based on the type, these adverse drug reactions are classified into 5 types. Type A, Type B, Type C, Type D and Type E. But Type A and Type B are most commonly seen, and Type C, D, E are very rare. So here Type A. Type A is type of drug reaction which is augmented. In the sense, we can predict these adverse drug reactions. If we take these type A are further classified as it is related to the pharmacological action of the drug. So here a doctor or a medical practitioner, he can say that these may be the side effects of this drug. So because we are taking this drug and the drug is going into the body and it is showing its effects. So based on the effects, based on the pharmacological action of the drug, the medical practitioner can predict what kind of the side effects the person may face. The other one is predictable. As I said, these are predictable. They can be easily predicted based on the reaction they produce in the body. And these are common type of adverse drug reactions like headache, dizziness. These are the common type. These all come under type A. Diarrhea, constipation. These are common side effects and they can be predictable and they are not that serious also. Another one is dose dependent. So the type A type of adverse drug reactions are dose dependent. So if there is any increase in the dose, then only these side effects occur. These type A type of adverse drug reactions are further classified into 2 types, that is extension of primary effect. The other one is secondary effect. So extension of primary effect. So what does this mean? So we are taking medication and it is showing pharmacological action, and the drug treatment has to be extended. or the drug we have to take in order to if we are taking medication and that is not showing that much desirable effect, then it needed to be, then that drug therapy has to be extended. So because of the extension of the primary therapy, whatever the adverse drug reactions we are facing or whatever the side effects we are facing, that come under the extension of primary effect. And these drug therapy are predictable and they are augmented. For example, if we take the bradycardia with propranolol, so we are using propranolol for many. Propranolol is a beta blocker and it is having many useful effects, like it is used in hypertension, it is used in arrhythmia, and it is used in various other, it is used even as an analgesic agent also. So here this propranolol, it is not showing that adverse effects initially, and the drug therapy has to be extended. So because of the extension or because of the chronic use of this drug, it leads to a condition called as bradycardia, which is predictable. Secondary effect. Secondary effects are due to the secondary pharmacology of the drug. So here the drug may show various pharmacological actions in the body, or if we are taking one or two medications, because of the pharmacological actions which these drugs are showing in the body, that may lead to severe drug effects. So here the action different from drug therapeutic actions. So here one drug, if it is showing the other actions, then it's therapeutic. For example, we are taking a drug for pain. Instead of showing its pain, it is showing antipyretic effect or fever reducing effect. So instead of one effect, we are taking this medication for one effect and it is showing the other effect. So such type of actions, such type of pharmacological actions lead to this secondary side effect. So because many drugs, so if we take few drugs, they are having both, they are having analgesic action, antipyretic action, as well as anti-inflammatory action also. If we take for fever, they are used as an anti-inflammatory. So all these types lead to the secondary drug effect, and the action is still rationalized. We can say, from the unknown pharmacology, from the known pharmacology of the drug. So we can know that, we can predict that, and so that we can take some care in order to reduce these side effects. For example, the bronchospasm with propranolol. So here the bronchospasm, here the propranolol is causing the bradycardia's primary effect. So the bradycardia, it is showing the bradycardia's primary effect, and along with that, if propranolol is taken and it is showing other effects, so on the respiratory system, it may lead to spasm or constriction of the bronchi. So this is a secondary effect. So it is an added effect to that drug. So such kind of reactions are called as the secondary effects. Now let us see the other type, that is type B type of adverse drug reactions, and these are bizarre. Bizarre in the sense they cannot be predictable, and that may be severe. These may be severe also. So here these drugs are not predictable, and even if we know the pharmacology and even if we know how the drug is acting in the body also, the side effects are not predictable for such kind of adverse drug reactions, and these are not dose dependent. So if we even give in the therapeutic doses also, these adverse drug reactions may occur in the body, and these are not readily reversed. In the sense, if the adverse drug reactions occur, it is not that easy to reverse those, or it is not that easy to remove or to reduce those side effects. Otherwise, these type of side effects are less. In the sense, we can see them very rare, but they are very serious. If they occur, they can be very serious also, and they may be life-threatening. This type B adverse drug reactions are further classified as idiosyncratic, drug allergy or hypersensitivity reactions, drug intolerance, and pseudo-allergic reactions. Here, if we see the mechanism of action of this type B type of adverse drug reactions, these are chemically reactive metabolites. So here, the drug, after it is undergoing metabolism in the body, it forms a metabolite. So these metabolites, it may be reactive. It may react with other drugs in the body or other substances. So there are various ions, there are various molecules in the body. So here, this metabolite may react with the sodium or potassium or chloride, which is present in the body, and that may lead to a harmful product in the body. So because of that, which is not even removed, or this drug is a non-detoxification of the metabolite. So it is a non-detoxification. It can't be detoxified. So it is very toxic to the body, and that then this metabolite, if it is entering into the cell, it may cause the toxicity to the cell, and there may be cell death. So if the cell is dying, if the cells are damaged, then it may lead to the tissue death and finally the organ death of the person. The other one is drug intolerance. So first type of, the types of these adverse drug reactions are, first one is drug intolerance. So here the drug, if we are taking any drug, the drug may be tolerant, and this is the drug may be accepted by the body. But here if the drug is having intolerance, or we cannot tolerate in taking that drug, so that may lead to severe side effects. For example, the aspirin which is given in the disorder of tinnitus. So in tinnitus, if aspirin is given, it may lead to the drug intolerance or type B type of the adverse drug reactions. The other one is pseudo-allergic drug reactions. So here few drugs, they release histamine. So if we take the drugs like D-tubocurarine, skeletal muscle relaxants like D-tubocurarine, mevacurium, so these are the drugs which release histamine from the mast cells. So they indirectly, they are acting on the mast cells, and they cause degranulation. They cause degranulation of the mast cells, and thereby the histamine is released. So because of the histamine, the allergic reactions are occurring. So these are the adverse drug reactions of these drugs. So these drugs are, we can say these come under the category of type 1 type of hypersensitivity reactions. The other one is idiosyncrasy. So idiosyncrasy or idiosyncratic type of adverse reactions are those which are hereditary, or these are genetically obtained. So these inherent qualitative abnormal response to the drug. The other one is due to genetic abnormality. So if there is any genetic abnormality, for example, if we take due to the heredity or from their ancestors or ancestral origin, they may have the deficiency of few enzymes. So these few enzymes are required in the main functional or biotransformation reactions in the body. So if the body is lacking these enzymes, then that may lead to severe side effects. So these type of adverse drug reactions are called as idiosyncratic type of adverse drug reactions, and these are the occurrence of these type of adverse drug reactions are very rare, in the sense it occurs in very few people, but if it occurs, then it is life threatening. If we take these idiosyncratic type of abnormalities, or whatever the abnormalities of genetics are caused, these may be due to enzyme abnormality or receptor abnormality. So if we take example, the hemolysis with primaquine. So primaquine is an anti-malarial drug. Here the enzyme abnormality, so the glucose 6-phosphate dehydrogenase. So glucose 6-phosphate dehydrogenase is a very important enzyme which is used in the process of glycolysis or gluconeogenesis. So it is involved in the process in order to produce energy from the glucose. So if the person is lacking this enzyme, then if a person is taking the primaquine drug, so he lacks the enzyme and he is taking primaquine drug to treat malaria, then because of the reaction which is undergoing in the body, that may lead to hemolysis leading to the hemolytic anemia. There occurs the rupturing of the RBC, and thereby the RBC death occurs. So that leads to anemic condition. So the anemia is a serious adverse drug reaction which is occurred because of the lack of the enzyme called as glucose 6-phosphate dehydrogenase if we take primaquine. And the other type is that receptor abnormality. So here if we take malignant hyperthermia with general anesthetics. So these general anesthetics, they act on the receptor, they act by the receptor mechanism. So there may be sudden huge rise in the calcium concentration. So here the person is having, the person is taking general anesthesia, and the person is having some receptor abnormality. There may be abnormalities in the receptor functioning of the person. then if he is taking halothane, this halothane, after it is entering into the body, it will increase the intracellular calcium level. So intracellular calcium concentration is increased. So the calcium levels are increased in the body, that leads to the depolarization of the cell. So if the cell is getting depolarized, that will increase the muscle contraction, or the muscle tone will be increased. And if the muscle tone because of the increase in the muscle tone and because of the increase in the metabolic reactions, it will also cause increase in the metabolic reactions. So because of all these, the see, any chemical reaction, there are some endothermic reactions and exothermic reactions. So endothermic reactions are those which release the heat because of the chemical reaction. So here, because of the few of the chemical reactions which are occurring, especially with if we take halothane and if there is receptor abnormality, then that may lead to malignant hypothermia. That is, there will be rise in the temperature inside the body. The other type of reactions are hypersensitivity type of reactions or drug allergy. So if we take, these are the first dose of the drug act as an antigen. So here, if we take if there is any foreign particle or foreign body or microorganism entering into the body, our body will release an antibody against that. So this antibody will go and bind to the antigen, and thereby the antigen will not cause any harmful effect. So we are, for example, we are giving vaccinations. So vaccinations, we are giving vaccination in order to prevent any disease. So first we'll give vaccination, and for first dose it is acting as an antigen. So it is acting as a foreign particle, and thereby the drug releases antibodies to that, and thereby this antigen is removed. But here, for the next time, if we give the same dose, the body will not release antibodies because it can't identify the antigen. And if the body is not identifying the antigen and the antibody is not released, then that antigen will cause serious effects in the body. So such type of reactions that may lead to antigen-antibody reaction, and thereby it may cause allergic reactions to the skin. If we see, this is the type of hypersensitivity reaction. If we take penicillin, so penicillin is an antibiotic. So we are giving penicillin initially, we are taking penicillin as a vaccination, and later if we give penicillin, that may induce anaphylaxis. So anaphylaxis is a serious type of type 1 hypersensitivity reaction. There are various allergic reactions. So here we are saying drug allergy. So the allergy which is caused because of the drug. So there are various types of allergic reactions which are occurring in the body. For example, if we take type 1 allergic reactions. So type 1 allergic reactions are immediate, in the sense if we give drug, they show immediate reaction. So they show immediate reaction. So for example, the anaphylactic type, or they are anaphylactic in the sense because of the release of IgE, immunoglobulin E. So that leads to the severe type of adverse effects. For if we take the example, the anaphylactic reactions which are caused because of the penicillin. The other type are type 2 type, which are cytotoxic antibodies. So there are antibodies like IgG, immunoglobulin G and immunoglobulin M, which are cytotoxic, that may be toxic to the cell. For example, the methyl dopa. So methyl dopa is adverse effect is that it may cause hemolytic anemia. It leads to the hemolysis of the RBC. The third type is that serum sickness. So the drugs, the immunoglobulins, the antibodies like IgG and IgM, that may form the antigen and antibody complex, leading to the adverse drug reactions, like they may form lupus type of reactions, or they may cause the allergic reactions in the body. Lupus type in the sense a rash is formed on which a blister is formed. So the drug, this type of, lupus type of effects are induced with the drug called as procainamide. The fourth type is that delayed hypersensitivity reactions. So delayed hypersensitivity reactions are like, first initially after the antigen is entering into the body will not identify. Later, once it is identifying, it releases the T cells. T cells are the type of cells which are present in the immune system. So because of the antigen and antibody reaction which is caused because of these T cells, it may lead to the serious adverse drug reactions. For example, the contact dermatitis. It is a skin disorder. No. Let us see the type C type of adverse drug reaction. So type C type of adverse drug reactions happens on long-term use of any drug. So if we are taking any medication for a longer period of time or chronic period of time, then these type of adverse drug reaction occur because of if we take any drug for the drug is having a T-half of about 24 hours. So daily we have to take the drug, and we are taking drug today, and after 24 hours only half amount of the drug is removed. Remaining half is present in the blood circulation itself, and tomorrow we are taking the drug. Tomorrow again after 24 hours half amount of the drug is released. So half is present and half is eliminated. So here the drug is getting accumulated. So because of the accumulation of the drug, that may lead to severe adverse drug reactions. For example, if we take analgesic neuropathy with paracetamol or NSAIDs. So we are taking an NSAIDs, and that is non-steroidal anti-inflammatory drugs and paracetamol for chronic use, that may lead to analgesic nephropathy. We are taking any drug and we are taking those drugs for a longer period of time, so the effect or the adverse drug reactions which are caused by this drug can be showed very long, or else we can say the effect can be showed delayed. For example, the adverse drug reactions which are shown are teratogenesis and carcinogenesis. So carcinogenesis is nothing but the carcinoma detected, or the cancer type of cells. Carcinoma are those cancer type of cells which are detected on long-term usage of any drug. The other one is teratogenesis. So teratogenesis is a type of abnormal congenital disorder which is occurring in the fetus. So, for example, the drug like thalidomide. So, thalidomide is banned now because of the teratogenic effect it is showing. So, this thalidomide, it is first detected as a teratogenic drug. So, the pregnant women, if they are taking this thalidomide, then it is causing some abnormalities, or it is causing some abnormality or deformities in the development of the fetus. So, here we can see it causes phacomelia, in the sense the limbs will be like flippers. So like penguin. So we can see the penguin feet and hands. So how the penguin feet and hands are there, in such a way the limbs of the baby are developing. So that this is one type of teratogenic effect which is caused because of the thalidomide. Here we can see the Victorian representation. They are like penguin like hands or feet. So this is one type of the teratogenic, or the one type of adverse drug reactions which come under the type D type. There are other teratogenic drugs like cytotoxic drugs or anti-cancer drugs, vitamin A and anti-thyroidal drugs, steroidal preparations and oral anticoagulants. So these drugs on long-term usage, they may cause teratogenic effect. Type E type of adverse drug reactions. So type E type of adverse drug reactions are ending of any drug use. Type EE for ending of any drug use. So we are taking medication and all of a sudden we have stopped using that medication. So this is called withdrawal syndrome. So we are taking drug and suddenly we have stopped taking that drug, then that leads to the withdrawal syndrome. Because of the withdrawal of the drug, it may lead to adverse drug reactions. So here if we take the example of corticosteroids. So corticosteroids should not be stopped all of a sudden. So the dose has to be reduced on regular basis, and then finally the drug has to be withdrawn. So the adrenocortical insufficiency, when glucocorticoids are abruptly withdrawn, when we stop taking glucocorticoids, then it may lead to adrenocortical insufficiency, and suddenly body suffers from glucocorticoid crisis, or the body will be in the sense the body will be asking for glucocorticoids because we have used, the body got addicted to that. So we have used glucocorticoids for a chronic period of time, and if we stop all of a sudden, then it may lead to severe adverse drug reactions. Now, who are the people who are prone to these adverse drug reactions? Who are the one? So anyone who is taking drugs or anyone who are taking medications, all these group of people are prone to the adverse drug reactions. And who are the who are the persons or who are the patients who are more prone to adverse drug reactions? So if we see young group, so who are teenagers or old or female type. So teenagers, old people and females, these are more prone to adverse drug reactions, and who are taking multiple therapies. So who are taking more than one therapy or who are taking more than one medication. So all these type of group of people. The other one is 50% of the patients on 5 drugs or more. So if who are taking 5 drugs or there are multiple medication, this is called multiple medication, who are taking 5 drugs or more. Multiple therapies involve different therapies, or if a person is having diabetes, hypertension, and he is having atherosclerosis, so he is taking therapy for diabetes, therapy for hypertension, therapy for angina or atherosclerosis. So these are multiple therapies. So because of these multiple therapies, these adverse drug reactions occur. And who is taking 5 drugs or more in a single therapy, if he is taking 5 drugs or more, then that leads to adverse drug reactions. And have more than one medical problem. So if they are having more than one medical problem also, then that leads to adverse drug reactions. And they have history of allergy or previous reactions to the drugs. So if a person is having any drug allergy before, he took a drug before and he is having allergic to that, and if he is taking the drug later, so that also may lead to adverse drug reactions. Commonly involved drugs which are causing adverse drug reactions. So what are the common drugs which causes adverse drug reactions? Are those antibiotics, anti-neoplastics or anti-cancer agents, cardiovascular drugs, and hypoglycemics, and NSAIDs or analgesics, and CNS related drugs, whether it may be antidepressants or anti-epileptics or any CNS related drugs. What are the causes? So what are the causes for the adverse drug reactions? First, it may be drug cause. So it may be the side effects of any drug, or it may be the drug interacting with the food or the drug interacting with the drug. The other one is patient cause. So if a patient is not taking the medication properly, or if the frequency of the therapy is discontinued, then that leads to the severe adverse drug reaction. So this is from the patient side. The other one is prescriber's error. So if a doctor is not prescribing properly, or in the sense if he prescribes properly, if it is not given properly by the pharmacist, then that leads to the adverse drug reaction. So this adverse drug reactions mainly, this medication error mainly occurs at the type C, D and E type of adverse drug reactions, and because of the polypharmacy. So if we are taking many drugs, then that also leads to these adverse drug reactions. Now let us see the symptoms. So what are the symptoms which can be observed because of the adverse drug reactions? First thing is that there will be confusion in the person. So person can't focus on one thing. Nausea and decreased balance. So the electrolyte balance or whatever the body balance is not proper, and change in the bowel pattern. The person may have either diarrhea or constipation. Sedation, he feels always sleepy, and the orthostatic hypotension, that may be fall in the blood pressure.